So, I am here to discuss a new lecture on community services in rural, urban and social health. Okay. Part number 1, in this lecture we will discuss about the services in urban areas or rural areas, and there will be a part number 2, we will discuss about the social school health. Yes, the community services in the school health. So, let us start with the healthcare infrastructure in the rural areas. So, the healthcare infrastructure in rural areas carries of sub-centers, the primary healthcare centers and the community health centers. Okay. So, the first here is the sub-centers. So, sub-centers are the first approachable centers. Okay. They are the most peripheral contact point for the public, okay, and the peripheral contact between the public and the primary healthcare center. Okay. So, in this sub-centers we have one HW health worker, okay, and one health worker who is female health worker we required, and one health worker male health worker. Okay. So, if we will see for the rural areas what is the common infrastructure. So, on the this lower section we have sub-centers. Firstly, the public will approach to the sub-centers, okay. They are the first peripheral contact for the public. Now, in these sub-centers, I told you we have health worker one female and health worker one male, okay. In these of the sub-centers, there are some basic facilities, okay. There are some basic testing facilities, okay. The facilities for the vitals check, okay, and then there are some common drugs are also available, common equipments are also available in these sub-centers. After that, there is the referral to the PHC, okay. And when there will be referral, of course, when the patient's condition require it, okay. That referral is given by the sub-center physician to the primary health care center, okay. Then from the primary health care centers on the top we have community health center, okay. This is the basic infrastructure of for the rural area, okay, first, second and third. So, I told you about these sub-centers and who will be in these sub-centers. Then we will see here primary health center. What are primary health center? This is the referral unit. I told you from the sub-center the patients will be referred to PHC. So, this is known as a referral unit, okay. For how many sub-centers? 6 sub-centers, okay. So, one PHC will be referral center for 6 sub-centers, and this consists of 4 to 6 bedded manned with medical officer in charge, okay. Who will be there? A medical officer in charge will be there, and there will be staff members. So, 14 subordinate paramedical staff will be there, which is consisting of nurses, lab technician, okay, a pharmacist, all of these. So, this is all about the primary health center. What is important here is it is for per 6 this referral unit is for per 6 sub-centers, consist of 10 bedded, 4 to 6 bedded, yes. Then community health centers. On the top we will see CHC. So, CHC is a 30 bedded hospital and a referral unit when the patient is referred from the either from the PHC or can be referred from the sub-centers as well, depending on the requirement, okay, or the condition of the patient. So, this CHC is referral unit for 4 PHC, okay, for 4 primary healthcare centers. One CHC is referral for 4 PHCs, 4 primary healthcare centers, and this community health centers have some specialized services. Okay, there are some specialized doctors. Okay, like for cardiology, we have cardiologist. Okay, for gyno, we have a gynecologist. Okay, similarly, there for different divisions, we have different type of doctors. So, there are some specialized services also available in community health centers. Now, see what is the population norms. So, population norms for rural healthcare infrastructure, which is consisting of the 3-tier system, 3-tier healthcare system, sub-centers, primary healthcare centers and community health centers. What are their population norms? So, the areas are divided into 2 parts. One is the plain area and another is the non-accessible area, okay, or difficult accessible area we can say. And difficult accessible area means the hilly areas or the tribal or the difficult areas, okay, where the people are not easily access the healthcare facility. Okay. So, see here this chart what it is showing, there are 3 centers in the rural healthcare, primary area and hilly tribal difficult area. So, one sub-center will give care for 5,000 people in the plain area. Okay. These are the easily accessible area, and you can say more population density area means the population is there. Okay. So, if you will see the heavy tribal or difficult area where the people are less also. So, it is for 3,000 people, one sub-center per 3,000 population. If you will see the primary healthcare center, so it is for 1 per 30,000 population in plain area, whereas 1 PHC for 20,000 population in hilly tribal or difficult area. Okay. If you will see the CHC community health center, it is for 1 per 1,20,000 population per area, plain area. Okay. And 80,000 people or population per hilly tribal or difficult area. Okay. Now, what is the average population which is covered and what the data are showing here? So, the sub-centers, we have the sub-centers PHC and CHCs, and how much the population they are covering. It will see the average of all of the sub-centers, PHCs or CHCs we have in our country. So, one sub-center is covering 5,616 okay, people, and if you will see the primary healthcare centers, so they are covering nearly your 35,000 population, 567, and if you will see the community health centers, so it is nearly 1,65,000. Okay. And this data is up to 31st of March 2019. So, this we can see how the centers are, the norms for these centers are for per population, okay, according to the areas. So, see how many sub-centers we have. So, there are nearly 7,821 sub-centers which are upgraded. Okay. So, they are upgraded as health and wellness centers. What do you mean by health and wellness centers? They are the upgraded version. Okay. So, their facilities are accessible to all of the public. Okay. So, these health and wellness centers, sub-centers, okay, they are the upgraded version, and how many we have upgraded here is the 7,821 sub-centers out of total 1,57,541 1 sub-centers which are functioning in the rural areas. And if we will see the significant conversion of these sub-centers into health and wellness centers, so which states reported it? See, the states are here like Tamil Nadu. Okay. So, in Tamil Nadu we will see there are 985 sub-centers are upgraded to health and wellness centers. Okay. If we will see the Maharashtra, so 939 sub-centers upgraded into health and wellness centers. For similarly, we will see for the Gujarat, then for the Uttar Pradesh, the Chhattisgarh, Assam, Andhra Pradesh and the Karnataka. Okay, the numbers are written here, how many sub-centers are converted into health and wellness centers, the upgraded version of it. Okay. Now, we will see the states in which there is a significant increase of these sub-centers. So, see which are the states here, like Rajasthan. Okay. Rajasthan reported the highest increase, we can see 3000 sub-centers. Okay. Then Gujarat, then there is a Karnataka, then Madhya Pradesh, Chhattisgarh, Jammu Kashmir and Tripura. Okay. All of these states reported a significant increase in the sub-centers. And if we will see the percentage of sub-centers in government buildings, so they have also risen. How much the percentage here is? We will see it is from 43.8% to the 75.3%. What is the baseline here? 2005. Okay. From the 2005 we have taken the value 43.8% sub-centers were there in the government buildings, and if we will see the 2019 data, we have nearly 75.3%. Okay. Now, see the primary health centers. Okay. The second level in the 3-tier system of the rural area. Okay. So, PHCs at the national level we will see we have approximate 24,855 PHCs which are functioning, and they are divided as 16,613 PHCs and 8,242 health wellness center PHCs. Okay, means the upgraded version. In the rural areas, the data up to the 2019. Okay. So there is an upgradation of nearly 8,242 PHCs into the health and wellness center PHCs. Now, the significant number of conversion of PHCs in health and wellness centers PHCs have been observed in the states. Which are the states here? See, as we have seen for the sub-centers, similarly for the primary healthcare centers which are converted into health and wellness centers. So, the states here are Andhra Pradesh reported nearly 1,145, then Uttar Pradesh 946, Orissa 827, Gujarat 772, Tamil Nadu 716 and Telangana nearly 636 centers are there which are upgraded into health and wellness centers. Now, we will see the significant increase of primary healthcare centers in the states. So, what are the data? See, the states such as Karnataka, Gujarat, Rajasthan, Assam, Jammu and Kashmir and Chhattisgarh. There in these states we have seen the significant rise of the primary healthcare centers. Okay. And if we see the percentage of primary healthcare centers in government buildings, so they have also increased from what is the baseline here? See, it is increased from 69% to 94.5%. So, in 2019 we have 94.5% primary healthcare centers which is in the government building. Okay. And 69% of the primary healthcare centers in the government building were in 2005. So, there is a significant increase we have seen. Okay. Now, we will see the topmost level healthcare level system in the rural areas is the CHC, community health centers. Okay. Now, Up to the 2019, you will see there are nearly 5,335 community health centers which are functional in the rural areas of the country. Okay. You will see the significant rise of these community health centers, which are the states which have reported the highest number of the community health centers. So, these states are Uttar Pradesh, okay, 293 CHCs are there, then Tamil Nadu 350 CHCs, West Bengal 253 community health centers, Rajasthan 244 community health centers, then Orissa 146, Jharkhand 124 and Kerala 121. Okay. Now, we will see the percentage of community health centers in the government buildings. So, they have increased, and how they are increased, see, it was 91.6% in 2005, and in 2019 we will see the data. So, it is up to the 99.3%. Okay. Now, community services in rural areas can be from sub-centers, primary healthcare centers and community health centers. We have already discussed, and their population norms as per the areas, like the plain areas or the hilly areas, tribal or difficult areas, we have already covered. There is a one term called as a first referral unit, FRUs. What it means? First referral unit can be anything, okay, where the person will refer to first. Okay, so that is the first referral unit. So, as an existing facility, district hospital, sub-divisional hospital, community health center, etc., they can be first referral unit. Okay. So, these existing facility can be declared as a fully operational first referral unit only if it is equipped. Why someone will refer to the to other healthcare system? Of course, when the healthcare system, that particular healthcare system or the referral unit is equipped with those of the instruments or those of the facilities which the patient is requiring. Yes. So, see, if any existing facility, it could be district or community community healthcare center, subdivisional healthcare system, if it is equipped, only if it is equipped to provide the round the clock service for emergency obstetric. Okay. So, we have some points here like the obstetric care, newborn care, okay, in addition to all the emergencies due to the that any hospital is required to provide. Okay. So, they are under the first referral unit. Now, see, it will see the 2019 data. So, it is showing we have nearly 3,204 first referral units which are functioning in the country. What it means? Means any such type of hospitals like district subdivisional or community health centers, and they have the facilities. Which type of facility? Newborn care facility, obstetric care facility, okay, emergency means to manage the emergency. These type of facilities are there. So, total number here is this one, and out of these it will see 95.7% of FRUs, first referral units, are having the operation theatre facility, okay, and 96.7% have the functional labor room, okay. So, the facility for the pregnant mothers, and by 75.3% of the first referral unit having blood storage linkage facility, okay, if the blood is required at the time. So, there should be a blood storage linkage facility also. Now, we will see the urban health infrastructure. So, see, urban health infrastructures consist in this there is a two-tier system, okay. So, the healthcare infrastructure in urban areas consist of community health center and primary healthcare centers. There are no sub-centers. So, there are two things here. One is your primary healthcare center and another is community healthcare centers. Okay. Now, population norms for urban health infrastructure are here. For primary healthcare systems, what is the population? It is for one PHC for 50,000 population, whereas if you will see the community health centers, it is for 2.5 lakh to 5 lakh population. Okay, this is the population now. Now see, the urban primary health care centers, what they are doing, they are providing the comprehensive primary health care services like testing facilities, okay, then treatment of the patient. The National Urban Health Mission aims to establish urban primary health care centers, and this is under the NUHM, National Urban Health Mission, to upgrade the primary health care centers in the urban areas. Okay. Now, urban primary health care system is responsible, or center is responsible for providing primary health care and public health needs of the population. Okay. It is recommended that the urban primary health care operates preferably for 12 noon to 8 p.m. or in dual shifts, okay, so that the public can get the facilities, and this is all modified according to the catchment communities as well. Okay. Now, what are the packages under it? What are the services which are provided by the urban primary health care services? So, they are the inclusion of preventive care, they also include the promotive care, promotion of health, okay, by changing the lifestyle, by changing the food habits, okay, by changing the environment, okay. Then curative, if a person has with a disease, then treat it, so that is a curative part. Then rehabilitative means the counseling sessions are provided sometimes in the rehabilitative to revive the life again, okay. And palliative care, which is given at the terminal stage, okay. Now, further, in order to strengthen the comprehensive primary health care across the country, there is a one scheme which is known as Ayushman Bharat scheme, okay. And under this Ayushman Bharat scheme, what this scheme is providing, upgrading the health care centers into these health and wellness centers, okay, either it is the sub centers or primary health care centers. So, they are providing the upgrading their primary health care centers as the health and wellness centers, easily accessible to all, providing the facility to all, have the all of the equipments or supplies or drug consumables should be there, okay, so that the person will get the facility. Now, we will see the numbers here. So, urban community health center is set up as referral facility, okay. Once the person in the urban area will approach to the primary health care centers, then after that, if the facility is not available, depending on the requirement of the patient, the doctor will refer the patient to the urban community health centers, okay. So, first one urban community health center is per every 4 to 5 urban primary health care centers, okay. The urban health care center, community health care centers caters a population of 2.5 to 5 lakhs, okay, and the metro cities which are with more population, there the population reaches for 5 lakhs, okay. In addition to primary healthcare center facilities, it provides the inpatient services. So, in community health centers, what is there? There is the inpatient services, the admission facility is there, medical care is provided, surgical facilities are there, okay, for undergoing some surgery procedures, institutional delivery facilities is also there. It is generally 30 to 50 bedded facility, okay. Then see what are the services, the comprehensive services. In order to ensure delivery of comprehensive primary healthcare services, existing PHC would be converted to health and wellness centers, and services could also be provided and complemented through outreach services. Mobile medical units are there in the primary healthcare centers. I will talk about the primary healthcare centers. There are mobile medical units, okay. These units are providing facility from going one place to the another place. Then health camps are there, home visits are provided by the primary healthcare centers, community based interaction are there, but the principle should be, the principle of all of these, the primary or the secondary or the tertiary, they all what they are doing, they are providing the equity in their services, equal health to all, quality of the healthcare system and universality of the healthcare system. The therapy should be standardized and the financial hardship should not be there. Okay, so we have to control it so that we can apply the compliance or adherence in the treatment. Now see the what next data is on the status of urban healthcare infrastructure. So we have nearly 70% of urban primary healthcare centers which are located in the government buildings, okay, and 27% are in the rented buildings and 3% are in the rent free buildings. Yes. So this is about the urban primary healthcare centers, the status of these centers. And I will see the data up to the 2019, how many community healthcare centers are there. So we have nearly 350 community healthcare centers which are working in a country, functional in the country, and about 96% of these centers are located in the government building, whereas the 4% of these are in the rented places or rented buildings. Thank you so much everyone. I hope this is clear to all of you about the community services in the rural areas or the urban areas. What is the basic infrastructure healthcare facility in these of two areas. In the next part, we will discuss about the school health. So, thank you so much everyone. We will meet in the next lecture with